Fatty liver disease is a condition in which abnormal amounts of fat accumulate inside liver cells, exceeding the liver's normal capacity to store fat. Normally, the liver contains only a small amount of fat, but when fat makes up more than 5 to 10% of the liver's weight, it is considered fatty liver. This excess fat interferes with the liver's vital functions such as detoxifying harmful substances, regulating blood sugar, metabolizing fats, and producing essential proteins. Because fatty liver often causes no noticeable symptoms in its early stages, it is commonly referred to as a silent disease, allowing damage to progress unnoticed for years. There are two major types of fatty liver disease. The first is alcoholic fatty liver disease, which develops due to regular or excessive alcohol intake. Alcohol alters normal fat metabolism in the liver, increases fat synthesis, and reduces fat breakdown, leading to fat accumulation and direct injury to liver cells. The second type is non-alcoholic fatty liver disease, now also called metabolic dysfunction-associated steatotic liver disease. This form occurs in people who drink little or no alcohol and is strongly linked to metabolic disorders. NAFLD has become the most common chronic liver disease worldwide due to rising obesity and diabetes rates. The causes of fatty liver disease are largely related to lifestyle, metabolic imbalance, and underlying health conditions. One of the primary causes is an unhealthy diet, especially one high in refined carbohydrates, added sugars, sweetened beverages, fried foods, and saturated or trans fats. Excess sugar and calories are converted by the liver into fat, which then becomes stored within liver cells. Over time, this continuous fat storage overwhelms the liver's capacity and leads to fatty infiltration. Obesity, particularly the accumulation of fat around the abdomen, is a major risk factor. Excess body fat increases the release of free fatty acids into the bloodstream, which are taken up by the liver and stored as fat. Closely related to this is insulin resistance, a condition in which the body's cells do not respond properly to insulin. Insulin resistance, commonly seen in type 2 diabetes, increases fat production in the liver while decreasing fat breakdown, accelerating fat accumulation. Alcohol consumption is another significant cause, as alcohol metabolism produces toxic byproducts that damage liver cells and disrupt fat metabolism. Regular alcohol intake causes the liver to prioritize alcohol breakdown over fat processing, resulting in fat buildup. Even moderate but long-term alcohol use can lead to fatty liver in susceptible individuals. A sedentary lifestyle also plays a critical role. Lack of physical activity reduces calorie burning, promotes weight gain, worsens insulin resistance, and slows fat metabolism, all of which contribute to liver fat accumulation. Additional contributing factors include high cholesterol and triglyceride levels, rapid weight loss or extreme dieting, certain medications such as corticosteroids and chemotherapy drugs, hormonal disorders like hypothyroidism, polycystic ovary syndrome, and genetic predisposition, which can make some individuals more susceptible even with mild risk factors. If fatty liver disease is not addressed, it can progress from simple fat accumulation, steatosis, to inflammation of the liver, steatohepatitis, then to fibrosis, where scar tissue begins to replace healthy liver tissue. In advanced stages, this scarring can lead to cirrhosis, permanent liver damage, liver failure, and an increased risk of liver cancer. Despite these serious outcomes, fatty liver disease, especially in its early stages, is often reversible through lifestyle modifications such as balanced nutrition, regular exercise, weight reduction, good blood sugar control, and complete avoidance or limitation of alcohol.